What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my anatomy playlist. In previous videos, we talked about anatomy of the head and anatomy of the neck, anatomy of the thorax, of the abdomen, of the pelvis and perineum. We also talked about neuroanatomy, anatomy of the upper extremities and the lower extremities, and even embryology. Today, let's dig deep into the arteries of the pelvis. As you know, the main artery of the pelvis is the internal iliac artery, formerly known as the hypogastric artery. I'll tell you why it was known as hypogastric later in this video. Click the like button, click the subscribe button, and let's get started. Remember that this is your left ventricle. It has oxygenated blood, indeed, and then you go to the aorta. Between the left ventricle and the aorta, we have the aortic valve, which is made of 3 cusps. Refer to my video on the thorax to learn more about the structure of the heart and lungs. Then I have the ascending aorta. Don't forget the coronary arteries come from the ascending aorta, followed by the arch of the aorta, which has the 3 famous branches of brachiocephalic artery, left common carotid artery, and left subclavian artery. These are non-negotiables. You cannot afford to forget the name of these 3 branches of the aortic arch. I should be able to wake you up from a coma, and you should not forget the names of the 3 branches of the aortic arch. Let's say that I was involved in a brutal car accident, and I come to your hospital bleeding from every wound. Before I even let you touch me, I'm going to ask you 2 questions. Question number 1, what are the tributaries of the portal vein? Name the 2 tributaries of the portal vein. This is the classic Mercedes sign. If you did not know the answer to this already, shame on you. The tributaries for the portal vein are the superior mesenteric vein and the splenic vein. The second question that I will ask you is, please mention the 3 branches of the aortic arch. And if I do not get my answer in 3 seconds, I will not let you touch me. You're not gonna be my doctor, c'est impossible. I would rather succumb to my wounds and die from hemorrhagic shock than be treated by a schmuck who does not know the branches of the aortic arch. After the aortic arch, there is descending thoracic aorta. The aorta is gonna pierce the diaphragm at the level of T12, and then it will enter the abdomen and become the abdominal aorta. For the excellent students, in some people, there is a 4th branch that comes off the aortic arch. What's the name of that 4th branch? If you know, comment below. If you wish to see more videos like this in the future, drop a heart emoji in the comments. This video is part of my anatomy playlist. Please watch these videos in order. And if your exam is coming soon, check out my anatomy review videos, where we review every branch in anatomy. All of these videos are in this anatomy playlist, or even better, you can go to my In 90 Minutes Quick Review playlist, where you will find review videos for the anatomy of the head and neck, anatomy of the thorax, of the abdomen, the pelvis and perineum, upper extremities, lower extremities, embryology, and neuro. Each one of these subjects is covered in 3 videos. For example, there is part 1 for the thorax, we call that quick review. Part 2 for the anatomy of the thorax, that's ultimate review. And part 3 is clinically oriented anatomy of the thorax. And we repeat the same process with every subject. But wait, there is more. I have review videos for physiology, for biochemistry, for molecular biology, genetics, pharmacology, pathology. I cannot forget microbiology, so there is a video reviewing general micro, 1 for gram-positives, the other for gram-negatives, 1 for viruses, 1 for fungi, and also human parasitology. I have review videos for every subject in internal medicine, so I reviewed cardiology in 2 videos, neuro in 2 videos, 2 for pulmonology, 2 videos for endocrine, 2 for heme, 2 for onc, 2 for immunology, 2 for rheum, 2 for nephro, 2 for GI, 2 for skin, 2 for eyes, 2 for ears, then infectious diseases, geriatrics, and EKG, as well as emergency medicine critical care. If you want review videos for these subjects, please let me know in the comments. And also review videos for surgery, as well as pediatrics, obstetrics, and gynecology. All of these review videos are in a playlist titled In 90 Minutes Quick Review. Now, what are the topics that you will learn about in my videos on anatomy of the pelvis review? Here is a list of the topics covered in these review videos for the anatomy of the pelvis. Today we're only talking about the arterial supply. Let's get into it. Ascending aorta, aortic arch, descending thoracic aorta. pierces the diaphragm at the level of T12 to become the abdominal aorta. The abdominal aorta is going to give me the three branches for the foregut, the midgut, and the hindgut, which are the celiac trunk, superior mesenteric artery, and inferior mesenteric artery, respectively, at the level of T12, L1, and L3, respectively. Why did you skip L2? Because L2 is for the two kidneys. These are the renal arteries. Don't forget that your aorta is very generous and it's going to supply the diaphragm from the inferior surface by inferior diaphragmatic branches. In the midline, we have this median sacral artery just before the bifurcation. Also before the bifurcation of the abdominal aorta, we have those vertebral arteries or lumbar arteries for the lumbar vertebrae. And we also have some suprarenal arteries for the suprarenal or adrenal glands as well. At the bifurcation of the abdominal aorta into right common iliac and left common iliac, we'll have then the common iliac branching into the external iliac, which will become femoral after passing deep to the inguinal ligament, femoral arteries, the main artery of the thigh, and the lower extremities in general. And we have the internal iliac artery, which is the main artery of the pelvis. Recall that the external iliac artery, before passing deep to the inguinal ligament, gave us two famous branches. The lateral one is deep circumflex iliac artery, and the medial one is inferior epigastric artery, which will run in the anterior abdominal wall. It will ascend upward until this inferior epigastric artery anastomose with the superior epigastric artery. The inferior epigastric artery came from the external iliac, whereas the superior epigastric artery came from the internal thoracic artery, also known as internal mammary artery. Now, did this internal thoracic artery come out of the ascending aorta, aortic arch, or descending thoracic aorta? Please let me know your answer in the comments. We have talked about this before, but repetition is the mother of pedagogy. Here we have the two kidneys. You have the abdominal aorta to the left, and you have the inferior vena cava to the right. The inferior vena cava will give us the left renal vein and the right renal vein. Notice that the left renal vein is longer. Left is long, and because it's long, it's gonna receive something that the right never received, and that something is the left ovarian vein, which drains to the left renal vein. But on the right side, the right ovarian vein drains directly to the inferior vena cava. So left ovarian vein to the left renal vein, but right ovarian vein drains directly to the inferior vena cava. The same story is true for the testicular veins. Left testicular vein to the left renal vein, whereas right testicular vein directly to the inferior vena cava. And that's why these veins are known as the gonadal veins. In females, we call them ovarian veins, and in males, we call them testicular veins. But where did the ovarian arteries come from? Ovarian arteries or testicular arteries, or collectively gonadal arteries, came directly from the abdominal aorta. The external iliac artery continues as the femoral artery in the lower extremity. If you want to learn more about the branches of the femoral artery, please refer to my video on anatomy of the lower extremities. If you wish to download these doozy colorful notes, go to my website medicosisperfectionalis.com. If you want me to personally tutor you, reach out to me on my website. This is the classic vein, deep to the inguinal ligament. You have femoral vein, femoral artery, femoral nerve. Vein. The vein is from medial to lateral, not from lateral to medial. Do you want the vein to hit your pubis? No. I want the vein to move away from me. So V-A-N, in this order, from medial to lateral. After femoral vein, femoral artery, femoral nerve, we have psoas major and iliacus muscles, or their tendons to be specific. The iliopsoas will join forces to make one tendon that's going to insert into the lesser trochanter of the femur. This is the lovely abdominal aorta, which is on the left, but the inferior vena cava is to the right. The abdominal aorta pierces the diaphragm at the level of T12, whereas the inferior vena cava pierces the diaphragm at the level of T8. The esophagus pierces the diaphragm at the level of T10, between T8 and T12. Don't forget the crura of your diaphragm, right and left, and they crisscross. So this one becomes this one, and this one becomes that one. They surround the esophagus as you see. The lovely abdominal aorta is going to give us inferior phrenic arteries for the inferior surface of the diaphragm. It will give us suprarenal branches for the suprarenal gland or adrenal gland. It will give us right and left renal arteries. The abdominal aorta will give us the artery for the foregut, midgut, and hindgut, which are celiac trunk, superior mesenteric artery, and inferior mesenteric artery, respectively. And the abdominal aorta will also give us gonadal arteries, testicular or ovarian, testicular or ovarian. At the midline, we have one median sacral artery. We have some vertebral branches for the lumbar vertebrae. And the bifurcation takes place at the lower part of L4 or upper part of L5. Or you can say the intervertebral disc between L4 and L5. No one cares. Abdominal aorta branches into the right common iliac and left common iliac. How about the inferior vena cava? What are the tributaries of the inferior vena cava? We have right and left common iliac veins. We have some lumbar veins on the right and the left. And just like you see here, we have two renal veins, one on the right, one on the left. Remember that the left renal vein is long. And because it's long, it's going to receive two veins that the right renal vein will never receive. These two veins include something above me, something below me. Above me, left suprarenal vein. Below me, left gonadal vein. In females, it's called the left ovarian vein. In males, it's called the left testicular vein. As on the right side, the right suprarenal vein drains directly to the IVC. And the right gonadal vein also drains directly to the IVC. But on the left side, both the left suprarenal vein and the left gonadal vein drain into the left renal vein because the left renal vein is long. Next, just like we have inferior phrenic arteries, we have inferior phrenic veins and they drain into the IVC. We also have hepatic veins from the liver drain into the IVC. Please do not confuse the hepatic veins with the portal vein. The portal vein goes into the liver, but the hepatic veins drain from the liver. Here's the right common iliac, here's the left common iliac. Each common iliac will give us external iliac and internal iliac. The external iliac will become femoral, the main artery for the lower extremities, and the internal iliac artery is the main artery for the pelvis. This internal artery has gazillion branches in the pelvis. We have some branches coming out of the anterior division of the internal iliac. Other branches come from the posterior division of the internal iliac. The anterior division will give us obturator artery, which will enter the obturator canal in the obturator foramen, just above the obturator membrane that floors the obturator foramen. Internal pudendal artery, which is gonna accompany and follow the pudendal nerve inside the pudendal canal, which is below the levator ani muscle. Inferior gluteal artery for your inferior glutes. How about the superior gluteal artery? Oh, this came from the posterior division from the same internal iliac artery. Superior vesical. So we have inferior gluteal, but superior vesical, meaning superior aspect of the urinary bladder. We have superior vesicle and we have inferior vesical artery. In females, the inferior vesical artery is known as the vaginal artery. And this vaginal artery will take care of the vagina and part of the urinary bladder, hence vesicle. We have the uterine artery, which supplies the uterus and the upper vagina. We have the obliterated umbilical artery. In the intrauterine life, you had an umbilical artery, two of them, one on the right, one on the left, and you had one umbilical vein. Where did the umbilical arteries come from? They came from the internal iliac artery. Oh, that makes sense. And this is an artery, yeah, but in the intrauterine life, before birth, this umbilical artery carries what? Carries deoxygenated blood from the embryo to the mother through the placenta. And then mommy will take care of that deoxygenated blood for you. Mommy will exhale the carbon dioxide, inhale some oxygen, produce some oxygenated blood, and give the fetus oxygenated blood through the umbilical vein. So we have superior vesicle and inferior vesicle. We have superior gluteal and inferior gluteal. And we have middle rectal artery. But where did the superior rectal artery come from? It came from the inferior mesenteric artery, which is the artery of the hindgut. But where did the inferior rectal artery come from? It came from the internal pudendal artery, which is also a branch of the internal iliac. As for the posterior division of the internal iliac, it will give us the superior gluteal artery. We know that. It will also give us lateral sacral and iliolumbar. Iliolumbar, lateral sacral. Iliolumbar, lateral sacral. Remember that lumbar vertebrae are more superior, sacral vertebrae are more inferior. So, where is the common iliac? Here is the common iliac on the right side, external iliac and internal iliac. This is going to be the main artery for the lower extremities, but the internal iliac is the main artery for the pelvis. You can call it internal iliac artery and you can call it hypogastric artery because hypogastric means below the abdomen. And what is below the abdomen? Save the pelvis. Obturator artery is here. It's going to enter the obturator canal. Internal pudendal artery is here. It's going to enter the pudendal canal. Superior gluteal artery from the posterior division and inferior gluteal artery from the anterior division. Then we have superior vesicle and inferior vesicle. And because this is a male, we'll just call it inferior vesicle. But in females, this artery changes names into vaginal artery. In males, we will not see uterine artery. The umbilical artery has been obliterated because this is an adult. Where's the middle rectal artery then? This is the middle rectal artery. It's a direct branch of the internal iliac. But the superior rectal artery is a branch of the inferior mesenteric artery, whereas the inferior rectal artery is a branch of the internal pudendal. And we shall not forget the iliolumbar and lateral sacral arteries. Let's do it again. This is the common iliac artery. This is the internal iliac. This is the external iliac. The external iliac is going to give us two terminal branches. One is inferior epigastric artery and the other is external circumflex iliac artery, which is not shown here. As for the internal iliac, it will give us iliolumbar, lateral sacral, superior gluteal, inferior gluteal, internal pudendal artery, middle rectal artery, inferior vesicle, superior vesicle, obturator. Here is a sneaky question that your atrocious professor might ask. The question is, name the muscle that separates the superior gluteal artery above it and the inferior gluteal artery below it. The answer is, it's the piriformis muscle. This is the piriformis muscle, separating the superior gluteal artery above it from the inferior gluteal artery below it. This is the piriformis. What does the word piriformis even mean? It means shaped like a pear. If you did not know this already, then you need to grow a pair, just like this male subject right here. Not my anatomy dad jokes when I'm talking about the pelvis. Well, look at that. This is the piriformis muscle. Above it, superior gluteal artery. Below it, inferior gluteal artery. This is the internal pudendal artery and is going to enter into the pudendal canal together with the internal pudendal vein and the pudendal nerve. The internal pudendal artery deserves its own video, so I've created a separate video on this subject. You can find it in my anatomy playlist. Quick notes on the uterine artery. A closer look at the uterine artery, which came from the internal iliac artery, also known as the hypogastric artery. The internal iliac artery is the same artery that gave us vaginal artery, also known as inferior vesical artery. Let's talk about the uterine artery, okay? It passes like this, medially, until it hits the lateral walls of the uterus. It passes within the broad ligament of the uterus between its two folds. The uterine artery passes above the ureter. So the ureter is below the uterine artery, meaning it's water under the bridge. The ureter is below the uterine artery. The water is under the blood, under the bridge. This uterine artery will supply upper vagina, it will supply the uterus, it will supply fallopian tubes, and it will end by anastomosing with ovarian artery. Where did the ovarian artery come from? It came directly from the abdominal aorta. This is the gonadal artery. Let's talk about the lymphatic drainage of the uterus quickly. The upper part of the body and fundus is going to go to the para-aortic lymph nodes. The lower part of the body, external iliac lymph nodes. How about the cervix? external iliac nodes, internal iliac nodes, and sacral nodes. How about the lymphatic drainage of the vagina? Upper part, external iliac lymph nodes. Middle part, internal iliac lymph nodes. Lower parts, superficial inguinal lymph nodes, just like the anal canal below the pectinate line. It was also to the superficial inguinal lymph nodes. What is the lymphatic drainage of the ovary? This is very important. The ovary, just like the testis, is a gonad. Gonads, during embryological development, started up near the abdominal aorta, and then they descended, and descended some more. And that's why their arterial supply, venous drainage, and lymphatic drainage are closely related to the aorta. So the ovarian artery came from the abdominal aorta. And the ovary is gonna drain to the para-aortic lymph nodes, also known as lateral aortic lymph nodes. Look at this water under the bridge. Ureter under the uterine artery. The uterine artery is very tortuous, as you see. The arterial supply of the uterus is from this uterine artery. How about the venous drainage of the uterus? Uterine veins, or the uterine venous plexus. And these will drain to the internal iliac vein, just like the uterine artery came from the internal iliac artery. Here is the anastomosis site between the uterine artery and the ovarian artery. Uterine artery came from the internal iliac artery, but ovarian artery came directly from the abdominal aorta. Question: why are these uterine vessels very tortuous, as you see? Zigzag action. The answer is to allow the uterus to expand during pregnancy without tearing the vessels. And if you have watched my video on the external carotid artery, I've told you that the lingual artery is also tortuous. Why? Because you move your tongue a lot, because you talk too much and eat too much. Moreover, the facial artery is also tortuous because you will have to move your face to the right and to the left. So to avoid these vessels from tearing apart, these arteries have to be tortuous. That's the reason behind arterial tortuosity, not to be confused with your boomer parents' moral virtuosity. When I was your age, I used to walk uphill all the time. Going to school, I walked uphill. Coming back from school, I also walked uphill. This is anterior, this is posterior. Symphysis pubis versus the promontory of the sacrum. This right here is the sigmoid colon, which will become rectum, which will become anal canal. That's the most posterior. Followed by the uterus, and then below it, the vaginal canal. And then the most anterior is the urinary bladder, and below it you'll find the urethra. Uterus is in the middle, and these are the fallopian tubes, and this is the ovary. Each ovary has two ends. One of them is closer to the fallopian tube. We call this the tubal end. The other end is closer to the uterus, so it's called the uterine end. The ovary has two surfaces. There is medial and there is lateral. It has two borders, anterior and posterior. The anterior border is attached to the uterus via the ovarian ligament, whereas the posterior border is free. We have three ligaments. One is called the suspensory ligament of the ovary, one is called the mesovarium, and one is called the ovarian ligament. Here you see the ovarian ligament. As for the suspensory ligament of the ovary and the mesovarium, they contain what? They contain ovarian vessels and nerves. The difference is that the suspensory ligament of the ovary is going to carry the ovarian vessels and nerves to the broad ligament, whereas the mesovarium is going to carry them to the ovary itself. And just like the sigmoid colon has sigmoid mesocolon, the ovary has mesovarium as well. It's a fold of perineum. Arterial supply for the ovaries include the ovarian artery and the uterine artery. Ovarian artery came from the abdominal aorta directly. Uterine arteries, on the other hand, came from the internal iliac artery. Internal iliac artery is the main artery of the pelvis. The word internal iliac is synonymous with hypogastric. What does hypogastric mean? Hypo means below, gastric refers to the abdomen. So hypogastric means below the abdomen, i.e. pelvis. And that's why the internal iliac veins could be called the hypogastric veins. And the hypogastric plexus of nerves or hypogastric nerves are nerves for the pelvis. What is the venous drainage for the ovaries? Well, ovarian artery will have ovarian veins. Ovarian vein on the right side drains directly into the inferior vena cava, whereas ovarian vein on the left side drains to the left renal vein because the left renal vein is long. So these are the 8 ligaments related to the uterus. There is a pouch in front of the uterus. It's the uterovesical pouch. There is a pouch behind the uterus. That's the pouch of Douglas, also known as uterine rectal pouch. And then there are more ligaments, 3 related to the uterine body, 3 related to the cervix of the uterus. And now let's talk about ovarian ligaments. There is the suspensory ligament of the ovary, which has the ovarian vessels. And this is a very important fact. Professors love to ask about this, and surgeons should be very careful with this suspensory ligament of the ovary, because if you cut it, boom, the ovarian vessels have left the chat. Besides the ovarian artery and vein, what else is in the suspensory ligament of the ovary? We have ovarian nerves and lymphatics as well. The ovarian vessels are in the suspensory ligament of the uterus, and they are also in the mesoovarium, which is part of the broad ligament. Third, between the ovary and the uterus itself, we have this ovarian ligament or ligament of the ovary. What is the arterial supply of the uterus? Uterine artery, which runs here inside the broad ligament between its 2 layers. Where did that uterine artery come from? From the internal iliac artery, which is the main artery of the pelvis. How about the venous drainage? What's the opposite of uterine artery? Oh, uterine veins. That's true. And these are tributaries of the internal iliac vein, the main vein of the pelvis. Let's talk about the vaginal artery or the inferior vesical artery. Next, let's talk about the vaginal canal, which extends from the pudendal cleft, this is the space between the 2 labia minora, and the cervix of the uterus. The vaginal canal or vagina has 4 fornices. There is the posterior fornix, the anterior fornix, and 2 lateral fornices. Think of a fornix as a tiny hidden pouch. These 4 fornices can be palpated on physical exam. Arterial supply of the vagina. Of course, the vaginal artery. Where did that come from? From the internal iliac artery, which is the main artery of the pelvis. Also, from the uterine artery, which also came from the internal iliac artery. This uterine artery is the main artery of the uterus. And then middle rectal artery also came from the internal iliac, and internal pudendal artery also came from the internal iliac. And don't forget that the internal pudendal artery is gonna accompany the pudendal nerve inside the pudendal canal, which lies below the origin of the levator ani muscle. What is the venous drainage of the vagina? We have vaginal veins which drain into the internal iliac vein, which is the main vein of the pelvis. The lymphatic drainage of the vagina is beautiful because we can divide the lymphatic drainage into upper part of the vagina, that of the middle part of the vagina, and the lymphatic drainage for the lower part of the vagina. Upper third of the vagina drains to the external iliac lymph nodes. Middle third of the vagina, internal iliac lymph nodes. Lower third of the vagina, superficial inguinal lymph nodes. Just like the anal canal below the pectinate line. And that's why I always teach my students that the proximal part of the vagina is part of the pelvis, whereas the distal part of the vagina is part of the skin. Similarly, the anal canal proximal to the pectinate line is part of the pelvis, whereas the anal canal below the pectinate line is part of the skin. And if you're part of the skin, you're going to drain to the superficial inguinal lymph nodes. Superficial because it's skin. This is the most important slide in the entire stinking lecture. This is the rectum, this is the anal canal. Above the pectinate line, below the pectinate line. What's the blood supply of the anal canal above the pectinate line? Superior rectal artery, which is a branch of the inferior mesenteric artery, the artery of the hindgut. Middle rectal artery, branch of the internal iliac artery directly. It comes from the anterior division, to be specific. And then we have inferior rectal artery below the pectinate line, and the inferior rectal artery is a branch of the internal pudendal artery, which is a branch of the internal iliac artery. As for venous drainage, above the pectinate line, we have superior rectal vein straight to the IMV, hashtag portal circulation. Middle rectal vein to the internal iliac vein, hashtag caval circulation. Inferior rectal vein below the pectinate line to the internal pudendal vein, and then to the internal iliac vein, which is the main vein of the pelvis, hashtag caval. Let's talk about lymphatic drainage of the anal canal. If you are above the pectinate line, you're part of the pelvis. You're going iliac, internal iliac lymph nodes. But the anal canal distal to the pectinate line is part of the skin, and the skin is superficial. Hence, superficial inguinal group of lymph nodes. Speaking of your skin, is your skin sensitive to pain? Well, I hope so. Why? Because the anal canal below the pectinate line is supplied by inferior rectal nerve, which is a branch of the pudendal nerve. And this is a somatic nerve, S234. And if you are somatic, you will be sensitive to pain. How about the anal canal above the pectinate line? It's not part of the skin, it's part of the pelvis, it's part of the viscera. And the viscera are, in general, not sensitive to pain, but sensitive to distension. Why am I not sensitive to pain proximal to the pectinate line? Because you're not supplied by a somatic nerve. Instead, you're supplied by an autonomic nerve, which are parts of the inferior hypogastric plexus. Hypogastric because we're in the pelvis. Now let's take it to the clinic. Let's talk about hemorrhoids or piles. External hemorrhoids hurt, whereas internal hemorrhoids bleed. Why don't the internal hemorrhoids hurt? Because they are not supplied by somatic nerves. They're supplied by autonomic nerves. Internal hemorrhoids bleed, whereas external hemorrhoids hurt. See, medicine makes so much sense once you understand what the flip you're talking about. That's why I always tell my students to get their heads out of their collective sphincter. Read the book, Adam. This concludes our review of the internal iliac artery. In the next video, we'll talk about the external iliac artery. If you want to learn about pregnancy, the normal changes of pregnancy, the complications of pregnancy, if you want to learn about parturition, childbirth, the complications that happen in the peripuerium, and the puerperal sepsis, i.e. peripartum sepsis, liver disease during pregnancy, heart disease during pregnancy, endocrinal diseases during pregnancy, and much more, download my obstetrics and gynecology high yields course at medicosisperfectionalis.com. It comes with videos, notes, and cases. To learn about all of the drama that takes place in your kidneys, proximal tibial, loop of Henle, distal tibial, collecting ducts, etc., download my kidney physiology course on my website. To learn about insulin, glucagon, testosterone, estrogen, progesterone, cortisol, and more, download my endocrine pharmacology course on my website. To learn about diuretics, digoxin, the antihyperlipidemics, antiarrhythmics, anti-anginal drugs, and antihypertensives, download my cardiac pharmacology course. There are more than 750 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.